Okay, so the first test we're going to do is the deep cervical flexor endurance test. What we're going to do is have the patient laying here on their back on the table. I'm going to instruct them to tuck their chins and raise their head off the table. We're going to measure the time from that start till basically the patient either untucks their chin or falls back down. And the mean time for this, according to the Cook text, is 46 seconds. So if they have any time less than 46 seconds would be a positive sign for either weak or lack of endurance in the cervical flexors. The next test we're going to do is the Quadrant Test. This test is done passively. The patient's going to be sitting here on the table. What I'm going to do is have one hand on the top of the head. We're going to combine the motions of extension, so we're going to bring it back to about 15 degrees of extension and side bending with a slight rotation. I'm going to apply a downward force straight into the ground with about 15 pounds of pressure. A positive sign would be a reproduction of symptoms. If it's a radicular pain, it's most likely due to the nerve root involvement. If it's more of a localized pain, it could be due to a facet joint pathology. Okay, so the next test we're going to do is the sharp pressure test. We're going to have the patient sitting here on the table in a relaxed position. I'm going to place one hand over the patient's forehead, and I'm going to place another hand, my thumb or finger, whichever you prefer, on the spinous process of the axis to stabilize it. I'm going to ask the patient to slowly flex their head forward while I press against their forehead, so I push back. A positive test would be if you feel the head slide backwards, and that would be an implication for injury to the transverse ligament. For the lateral flexion alar ligament stress test, what we're going to do is have the patient sitting, going to be facing away from us. We're going to palpate to find the spinous process of C2. Then we are going to have the patient side bend to the right, and that's going to tighten the left alar ligament. And what should happen is the spinous process of C2 should move in the contralateral direction of the side bend. And a positive test is a delay in the spinous process movement of C2, and that may indicate a pathology of the alar ligament. Okay, so for the next test we're going to do the spring test. And what we're going to have the patient do is lie prone on the table. I am going to find the spinous process of one of the thoracic joints, and I'm going to apply a posterior to anterior pressure on the spinous process. And we could also add a little bit of rotation, check that. Then we're going to move out and find the transverse processes. We're going to push on those again, posterior, anterior, and we could also do one-sided to check for the rotation. And we are assessing the quality of movement and the infills. And a positive test would be any pain or hyper or hypomobility in the facet joints. Okay, so the next test we're going to do is the one-legged extension lumbar test. We're going to have the patient stand on one leg. We want to make sure we start with the uninvolved side first and have them extend back. We're going to be standing here, make sure, just in case if they do fall, we'll catch them. And go ahead and stand up. And if there is pain on the same side in the facet joint, that would be a positive test for spondylosis. Then if there's pain with extension and rotation, so we'll have her do that again, and if there's pain and she rotates, that would be a positive sign for a facet joint pathology. And if there's pain within the PSIS as well, she does that, that would be a positive test for SI joint irritation. Next test we're going to do is the Quadrants Test, mainly focusing on the thoracic and lumbar region. What we're going to patient do is stand on both legs and extend back and a rotation. And I'm going to apply an overpressure. A positive test would be local pain in the facet joints, and that would be a problem with the facet joint. And then if there's any pain within the PSIS, that would be a positive sign for SI joint irritation. Okay, the next test we're going to do is a straight-legged raise test. This test is done passively. I'm going to have the patient laying here supine. I'm going to grab the testing leg basically at the distal quad and behind here at the calf. I'm going to move them all the way up as far as they can go without their knee flexing. And if there's any pain in the same side during 0 and 35, that would probably just be due to hypersensitivity. Anything between 35 and 70 would be due to neurological tension, and any signs past 70 is for muscle and joint pain. And once we get up to here, we can also add a sensitizing motion by dorsiflexing the ankle. And like I said, all of these symptoms should be seen on the same side. If there's any pain on the opposite side during this test, that would be a positive for the cross straight leg exam, and that would be to rule in a disc herniation. And the normal, just straight-legged, if there's pain on the side, that would be to rule out a disc herniation. The next test we're going to do is the Instability Catchline test. What we're going to have the patient do is flex their body forward as far as they can and return back to standing. A positive sign for this test is if when they flex forward, they're unable to return back due to a sudden onset of lower back pain. The next test we're going to do is the prone instability test. I'm going to have the patient standing right next to the table. Make sure that their hips are going to be touching here. And we're going to have them go ahead and hug the table. And once they're at this position, I'm going to apply a posterior to anterior force on each of the facet joints, checking to see if there is any pain. And maintaining this position, we're going to make sure that the patient's basically hugging onto the table. I'm going to have them basically bring their feet up off of the floor to this position, and I'm going to apply that same pressure to each of the lumbar. And a positive test would be if there's pain within the first step and the pain is relieved within the second step, that would be a positive test for prone instability of the lumbar region. Okay, so the next test we're going to do is the prone lumbar extension test. We're going to have the patient laying prone here. I'm going to grab here at the ankles and provide a little bit of a traction for us as I lift up and bring the legs off about 30 centimeters off the table. We want to make sure that the legs are staying completely extended the entire time and they don't flex. If there's pain up while they're up here and it's relieved as we return them to the beginning position, that would be a positive sign for a segmental problem or lumbar instability. Okay, the next test we're going to do is the standing flexion test. We're going to palpate and find the PSISs. What we're going to have the patient do is go ahead and bend forward and come back up. A positive test would be superior movement of one of the PSISs compared to the other side, and that would indicate a hypermobility of the SI joint. The next test we're going to do is the supine to sit leg length difference test. We're going to have the patient start in the supine position. Going to come down here and check the medial malleolus and take the difference. And the patient's going to come up into a long sit. And we're going to again measure the distance. And a positive test would be the affected leg in the supine is now corrected once they move into a long sit position. The next test we're going to do is the prone knee flexion test. We're going to have the patient lying prone, and we're going to compare the medial malleolus and check the leg length difference. Then we're going to have the patient flex their knees upward, and again we're going to compare the length of the medial malleolus, and the affected leg will be corrected, or a positive test would be the affected leg will be corrected when the knees are flexed up. Okay, for the next test, we're going to do the iliac gapping test. We're going to have the patient laying supine here, and I'm going to apply my arms on each iliac crest in a crossing manner, and I'm going to push down and out. And a positive test would be unilateral gluteal or posterior leg pain, and that would be a positive sign for a sprain of the anterior SI ligament. The next test we're going to do is the Quadrant Test. We're going to have the patient laying here supine, closer to the edge of the table. I'm going to move one leg off and just make sure that the hip's still on, and I'm going to grab the other leg and move it up into flexion. What I'm going to do is have one hand here on the knee, the other one on the distal thigh, and I'm going to basically apply pressure downward on the leg here and a upward pressure here to basically move them into opposite directions. Going to apply a force here. A positive test would be any pain in the posterior region, especially in the PSIS, and that would be a positive sign for an SI joint dysfunction.